Hello, doctor. This is Efren Collazo, and this is my video of the outcome assessment assignment. The objectives of my presentation are to present the PRO and the ROC scale selected for the assignment. I'm going to present the demographic information of the patients that participated in this process, present the outcomes measures collected during the rehabilitation programs of the patients, and analyze the data collected for interpretation of the outcome measures. I want to say that I was not able to participate of this rehabilitation process because I am not actually working on a clinical scenario. I'm teaching at the university level. So I have a friend, a colleague that helped me with that, and he run all the rehabilitation programs, collected the data, and then I collected all the information to present it to you today. I selected two clinical outcomes measures to complete the assignment. Uh, the first one is the patient reported outcome. I selected the patient specific functional scales because I knew that this instrument uh, with this instrument I can be open, or the patient can be open to write the activities that they cannot do uh, at the same level that they did before the injury, and knowing that maybe I don't have a lot of patients uh, to measure, so I identified that this general instrument would help me to have some data. So I selected the patient-specific functional scale, and where the patient can write the activities, and then he can measure at what level he or she is during the rehabilitation program. And then was the 7-point global rating of change scale. I didn't find any scale on the internet. So basically what I did was I write the instructions in Spanish, and I created the GROC scale specifically for the clinic. So they have the 7 points, and they are translated to Spanish, but they have the same meaning, in which we have 3 plus 2 minus 3 to measure all the levels of this outcome measure. Total number of patients, I only have two. This is a little clinic, and the person, the athletic trainer that works in the clinic, they have a lot of experience working with basketball. So all the physicians that are close to the clinic recommend or refer the athletes that have the injury to him, but the majority are lower extremity related sports. So there wasn't a lot of opportunity to have patients with upper extremity problems. At least we have two, and these two are the ones that I'm going to present to you. The patient number one is a 24-year-old male soccer player. He was diagnosed with a shoulder sprain, so it was a traumatic injury. The mechanism of injury, he outstretched his shoulder in a slide. He was trying to do a defense on his slide, and in some way, his shoulder gets stuck and outstretched. So we have the typical excessive horizontal abduction and external rotation mechanism. Uh, there was no injury to the labrum or any instability problems, which was only a shoulder sprain. So the treatment was basically the traditional ones: therapeutic modalities, ultrasound, hot pads, cold packs after the therapeutic exercises, and TENS and laser. And the therapeutic exercises, they did all the exercises with dumbbells, stability exercises, proprioception. So at the beginning it was a little bit uncomfortable, but then it was able to complete all these exercises. There was no discharge. He discontinued of the treatment plan because he had a knee injury. So they were now focused on the knee injury, and the patient reported that he felt better within the weeks that he received the treatment. So they was concentrating now on rehabilitating the knee, uh, and at the same time, the symptoms decrease with time uh, after treatments. Patient number two is a 20-year-old male basketball player. This player was diagnosed with shoulder dislocation. It was a traumatic injury, and that resulted in a bone injury. Uh, he had surgery on February 4, 2021, and the mechanism of injury, well, he was playing and an adversary pulled him from the arm in a game. So it was traumatic. It was a high pull that that, that created the instability and all the problems related to the shoulder dislocation. Uh, the treatment started 6 weeks after date of surgery and physical therapy. So uh, this athlete did not start to do rehabilitation in the clinic after 6 weeks. He was participating of normal traditional physical therapy, and after 6 weeks, he didn't have good results, especially with the range of motion and functionality. So after 6 weeks of physical therapy, then he moved. The athlete moved to the clinic, and then after 6 weeks, they started a new rehabilitation program, specifically for him and he as a basketball athlete. So therapeutic modalities, TENS, the same as traditional TENS, ultrasound, laser, uh, and hot packs and cold packs after the rehabilitation, the therapeutic exercises program. But then the therapeutic exercises were focused more on isometric strength in neutral position. So at this time, as today, he's not doing any concentric isometric exercises or eccentric exercises. He's just focusing on isometric strength, all the motions, abduction, adduction, internal rotation, external rotation, flexion, extension, but all in neutral position. When I say neutral position, is the shoulder in neutral position and the elbow at 90 degrees. And then you do the isometric strength training, 3 sets of 10 for each exercise. And obviously they're focused on basic range of motion due to degrees of range of motion. My colleague told me that at the time he started or he got the initial evaluation, he did not pass 90 degrees of flexion or even 90 degrees of abduction at 6 weeks. So definitely the physical therapy that he received was not good enough to restore range of motion. And also my colleague told me that the physician was very conservative with him, that he doesn't want to do something out of the traditional focus, and that was a problem, and this is a problem that we heavily see here in my country. So the necessity for athletic trainers to do more advanced therapies are needed. So in this charge, there's none. The athlete is still participating on the treatment program as today. When looking at the patient number one of the outcomes reported, the date of the initial visit was March 22, and he had basically 2 weeks of treatments. So we have 4 sessions, dates from March 22, March 24, March 26, and March 29, and he didn't have any activity missed because he can at least practice in the sport. He was a soccer player, so he didn't have to move or use his arm a lot, so he was not taken out of participation. And that are the result of this patient-specific functional scale. Interestingly, there's a lot. One of the things that impressed me in this activity are the activities of daily living that they reported that they cannot do. It was interesting for me to see at least that he said that he cannot apply his deodorant, that it was very difficult to raise his arm to do the activity. So at the initial date, he classified it as a 3, and a subsequent week, because he have the initial date measurement, and then the next week it was a 9. And he cannot hold the difference with the arm. If he have to fight a little bit to have the position on the game and have to hold the difference on the arm, he was not able to do it at 100%. So he marked that at 4 at the initial date, and then it really improved to 9. Two-wing bench press was a little bit difficult for him. He stated that he tried to do it, but he classified it as a 2. And then a subsequent week, he can do it at least an 8. And push-ups, he was not able to do really good push-ups. It was a 2, and then he moved the next week to 9. So this treatment protocol and rehabilitation program was good for him. So basically, we see that it was a sprain, and then the treatment program was able to promote healing and restore a little bit of function. For the global rating of change scale, the initial date, he said it was a minimally better without having any treatments, and then the next week, he said that it was a great deal better from the initial date. For patient number 2, the date of initial visit was April 22nd. That as today, he received 6 treatment sessions. The dates are April 22, April 24, 27, 29, and 31, and May 3rd. And he have, from the date of the surgery, he have 59 days of activity base, because he was completely out because it was a surgery. For the patient-specific functional scale of these athletes, he stated some really interesting activities that he was not able to do 100%. The first one is take out his shirt. At the initial date, it was a 4, and then at week 1, he reported it was a 6, and then at week 2, he reported it was an 8. And this is not, and this is starting, as I said it before, starting with the new athletic training rehabilitation program, because I talked to the athlete and he told me that he was not able to do anything. He take out his shirt with this traditional compensation that he put his arm close to his torso and he put the elbow inside of the shirt, and then to take out the shirt, he was not able to raise his arm to take the shirt as normally we do. So definitely this is one of the things that was not able to complete. Other interesting one is that he wasn't able to brush his teeth a lot. He also said to me that he started to use his left shoulder. He had a problem with his right shoulder. So he needs to brush his teeth with his left shoulder, with his left arm, because he was not able to do it as normally as he do. So now he's using now his arm again. The initial was 3. For the week 1, he reported a 6, and for after in the week 2, he reported an 8. Take out use from refrigerator was other one interesting. The beginning was he stated it was a 3, and then on week 1 he reported a 5, and week 2 he reported a 7. And tie up his shoes. Initial day was 4, week 1 was 6, week 2 was 7. Obviously, in this case, we cannot see sport-specific skills because he was a surgery, and we don't have a lot of time to measure his outcomes on the total program. So definitely going to be good to continue to use the patient-specific functional scale in the whole program and compare at the beginning, at the final date of the rehabilitation program. For the global rating change of scale at the initial date, Imari was a minimally better. He was a +1. And week 1, a great deal better, and week 2, great deal better. For the outcome analysis, I divided in 2 parts. The first one is the treatment protocol analysis. I could interpret that the modalities and exercises provided in the rehabilitation program were effective to promote healing and increase functionality. So this is the first time I know that my colleague did probably the traditional protocols, but this is the first time, really or not, It's the first time that I can see quantitatively that there's a really improvement of the functionality of the patient or the athlete in treatment program. So this is one of the things that I would take from the assignment, because now we have some measurements, some instruments to verify, to assess if we are doing a great job or not. Range of motion exercises are very important for improving shoulder functionality. We know that this is a textbook thing that we learn, but now that I have this case, that I have the opportunity to know that he didn't do well at the beginning of his rehabilitation programs with other treatments that were not in athletic training, clinical therapy, then we can see now that the range of motion exercises are very important for improving shoulder functionality. And after he started to do a more intense, a more specific range of motion exercises, he's doing much better, and PFS, you can see it and you can measure it, that this treatment is really helping him. Okay, activities of daily living functionality are great to assess improvement. This is one of the things that I didn't expect. I was expecting to see more sport-specific skills. We saw that with the soccer player, but it was a mix. No, at the same time, we are know now that there's not only sport-specific skills that are the causes that patient present to your athletic training room to receive an evaluation or receive treatment. Once they have problems with the activities of daily living, they now cease or seek for help. And it was good to see that our treatment programs can help to improve also the activities of daily living. General analysis on the instruments. We definitely know now that PROs and the Grok scales are definitely excellent instruments to measure outcomes. These were general PROs. Maybe I need to have more experience with some other specific PROs and see if they work and if they we can have good results or measure these results significantly. But at least with this appearance, I could say that these scales and these instruments are really, really important in our treatment and rehabilitation process, because we are now assessing that our job is that we are doing a great job with implementing these instruments. The PSFS can measure both activities of daily living and sport performance. I think this one is nice because it's open, as I stated at the beginning of my presentation. It's very open, and the patient can write not only the sport-specific problems that he has. He also or she also can write activities of daily living or some things that they want to do better. Grok scales should be administered separately to assess activities of daily living and sports performance. I think once we start with the rehabilitation program, I think there should be some periods, and we need to start to have an initial date different for periods. If I explain better, if I saw the case of the basketball player, I think he stated that he was a 3+ based on how he felt the week before. So if we as clinicians don't state it at the beginning that we want to assess how he feels from the initial date to the current day, there's could be a confusion, or we can interpret in two different ways. If he feels or she feels better from week to week, or if he is talking or she is talking about total rehabilitation program improvement. So I think we need to at least be clear with that, because I don't know if using only the grok scales we can interpret that he's feeling better week by week, or if he feels or she feels that maybe at week 1 I was doing good, but I now think that at week 4 I should be better than what I feel right now. So this is one thing that I see that we have to analyze better. So for now, I can say that the grok scales cannot be used alone. They have to be included with some other PROs to have a better analysis of what are the things that we are doing. That's what I think right now. So and this are my analysis. So bottom line, I think this is something different, new for me, but definitely I would do on a daily basis. I would start to include other PROs, specific PROs, and definitely I would think on the grok scales on how I can interpret it because of that. Maybe there's an interpretation of how he feels week by week or she feels week by week of what are the expectations of the patient. Well, I thought that from week 2 to week 3 I was gonna do better, and maybe we see an improvement in week 3 comparing with the starting date, but then that improvement from week to week is not the same, or we have good quantitative measurements, but maybe for the patient he's not doing good because he was expecting to be more or better than when he or she was expecting. So definitely that's one thing that I have to analyze in my future as using the grok scale. And that's it. That would be all. Thank you for listening to my presentation, and I also want to take the time to congratulate you for all the teaching that you have done on the week, and and I'm really impressed with your work and your professionalism. I appreciate all the time and all the things that you have done for all of us. Have a great night. Thank you.